After 6 months of picket lines and hundreds of thousands of cancelled operations and appointments, finally, an agreement on a pay deal for NHS workers.
So I'm pleased that the majority of health unions, that members accepted the recommendations we made, that it was the best alternative to waiting for the pay review body process to run out for this year. The hope is that lessons have been learned about the value of listening to NHS staff.
The deal means more than 1 million NHS staff will get a 5% increase and a lump sum, possibly as soon as June. But unions are divided. Unite and the Royal College of Nursing will re-ballot members, like Mark, over further strike action.
I can't, go to the students who I train and say, yeah, I think you're going to have a well-paid profession and a good career ahead of you based on this pay deal. And it was just going to create more anger. The way the government have handled this, imposing it on people, not reopening negotiations, it's just made people more angry and frustrated.
But the government says the matter is now settled.
This was a decision taken by 14 health unions. They reached a majority decision. It was negotiated collectively. The RCN were at the negotiating table. Indeed, Pat Cullen recommended this deal to her own members. So it's important that everyone now respects the decision.
As far as most of the health unions are concerned, their pay dispute with the government is now over. There are some difficult questions ahead for the RCN and Unite. And the government will see this breakthrough as proof that it can negotiate a deal with the junior doctors. A pay deal reached, but long-term issues remaining, including a record patient waiting list and still no workforce plan to address the crisis in the recruitment and retention of NHS staff. Ashish Joshi, Sky News in central London.